Emergency Management Director, who is off today. Please join me in a moment of silence for the lives we have lost to COVID-19 and for the families they leave behind. Now, we'll hear updates from our community leaders. First, we'll hear from the City of Albany Mayor, Bo Durr.
Thank you, Mr. McCoy. Good morning. We were informed the numbers continue to trend downward during this week's task force meeting. For reference, the census at Phoebe Putney, reported on January 20th and January 27th, was 108, and the corresponding positivity rates were 18% and 17%. The census reported on February 3rd dropped to 105, and the positivity rate fell to 14%. This Wednesday, we were informed the census for the previous week had dropped to 88, and the positivity rate had fallen to 11%. We have seen several positive developments. The Sheriff's Department has successfully resolved the outbreak in the jail. Fewer COVID patients are being transported to the emergency room. No Daugherty County school system employee tested positive last week for the first time in months. Elementary students returned to class on Monday, and middle and high school students whose parents have opted for in-person instruction will return to campus next Wednesday. There have been only 3 cases at ASU since classes resumed 3 weeks ago. MCLB is conducting sentinel testing. 234 civilians and soldiers have been tested with only 2 positive results. The number of deaths being reported by Mr. Fowler has in recent weeks declined significantly. Most importantly, citizens are being vaccinated. Only those in Tier 1A, being healthcare workers, residents of long-term care facilities, those over 65 and their caregivers, and first responders are included in this category. The Census Bureau estimates 16.5% of Daugherty County's residents are 65 and older. This would be approximately 14,000 people. Phoebe Putney, as of Wednesday, had administered over 24,000 vaccinations. Now, this figure includes those who have been vaccinated at Phoebe Sumter and Phoebe Worth, and those who have received the second shot. The Health Department has administered an additional 3,600 inoculations. Albany Area Primary Health Care is also operating a vaccination site at Phoebe East. I can report to you that the city is working cooperatively with the state and healthcare community to encourage citizens to be vaccinated and to make sure that the process is simple, quick, and as convenient as possible. We have enlisted prominent citizens to use their influence to urge those who have reservations to be vaccinated. There will be some pop-up sites in various neighborhoods in the coming weeks. Handbills are being distributed to residents to notify them of the time and dates of operation. We do not know when the vaccines will be available to those in Tier 1B, which consists of essential workers. Tier 1C will be those 16 to 64 with medical conditions that make them more susceptible to becoming seriously ill if infected. There is speculation that the vaccine will be available to the general population in April or May. The supply by that time should be sufficient to meet the demand, as the federal government recently ordered an additional 200 million doses of various vaccines. Additionally, it is expected that a third vaccine developed by Johnson & Johnson will be approved in the coming weeks. In the interim, we should continue to wear a mask, watch our distance, and wash our hands. Remember, the UK variant, which has been identified in Georgia, is much more contagious. The Centers for Disease Control recently made recommendations to make non-surgical masks more protective. These include selecting a mask with a nose wire, which is the metal strip along the bridge of the nose, layering your mask with a fitter, as this significantly increases the level of filtration and wearing a paper mask under a cloth mask, which is called double masking. I want to thank all of you who have taken precautions throughout the pandemic to protect yourselves and others. Good day.
Thank you, Mayor. Now we will hear an update from the Southwest Georgia District of the Department of Public Health from Dr. Ruiz.
Good morning. I agree with everything that Mayor Dura has mentioned this morning. He provided some very useful and accurate information. Our public health records agree that the new case numbers are going down essentially everywhere. In most places of the state, and certainly in all 14 counties in southwest Georgia, the new case numbers are going down, and that's very important. In the last 3 weeks, the new cases in Dougherty County have gone down by 50%. And that's great news. It's a great trend. However, the other side of that coin is that the number of new cases is still concerning. It's still high in the community. So while the trend is going in the right direction, we still have a problem in Dougherty County and in every county in southwest Georgia. So it's way too early to let our guard down. We need to continue to do those things that will keep us and our neighbors safe, including social distancing, wearing masks, keeping our hands clean, and staying home when we're sick. And now we have a vaccine available to those who have been deemed eligible. And our public health workers are very busy every day administering the vaccine, and there are many other community partners who are doing the same. Each and every day, more and more people are becoming vaccinated, and that makes our community safer and gets us closer and closer to that ultimate goal of herd immunity. One of the things that we need to continue to do is to get tested when we exhibit symptoms of COVID-19, or if we have been exposed to someone with COVID-19, and if we are not in a protective bubble, we need to get tested. So testing is easy to do, especially here in Dougherty County. It's available in a number of sites. There's a partnership between public health and a company called MAKO, M-A-K-O, and the Dougherty County Exchange Club Fairground. MAKO is an organization that is collecting specimens and testing them for COVID-19. They're doing so at the fairground here in Dougherty County 6 days a week. There's no charge for the test. It's absolutely free to the patient. However, patients will be asked if they have insurance, and the reason for that is so that we can get some reimbursement on the procedure from a third-party carrier, but there will be no cost to the patient at all. It's easy to get registered, and pre-registering is strongly advised. It will save everyone time. One easy way to do that is to go to the public health website. That's southwestgeorgiapublichealth.org, and on our website you'll see a link to MAKO's registration site. You can be tested without pre-registering, but it will slow you down if you just show up without being pre-registered. They're testing from 9 to 4 Monday through Friday, and 9 to 1 p.m. on Saturdays. If you are interested, if you're eligible for a COVID-19 vaccine, and if you would like to have that done through public health, again, it's easy to set up an appointment. The number to call is 229-352-6567. 229-352-6567. Currently, those who are eligible include healthcare workers, residents, and staff of long-term care facilities, adults age 65 and older, as well as their caregivers, law enforcement, firefighters, 911 operators, and dispatchers. The Public Health Department in Dougherty County has a short waiting list. Generally, if you call today, you will be able to get your vaccine if you're eligible within 1 or 2 business days. Originally, to call and make the appointment took some time because we had so many people calling, and the average wait was several minutes. In the last few days, the average wait is less than a minute. So it's easy to call and make that appointment. I would like to talk about one new advantage to getting the vaccine. The main advantages are that it will protect you from COVID-19. In doing so, that also protects others, because if you can't get COVID, then you can't transfer it to someone else. So the vaccine helps you and it helps the community. Those are the main reasons for getting a vaccine. But now there's a new reason. It's not the main reason, but it's icing on the cake. The CDC put out some new information about 2 days ago, and essentially what it amounts to is a bubble period of time following your complete vaccination that will allow you to avoid being quarantined if you are exposed to an active case. Now, there are some stipulations. In order to be in this bubble, you have to have completed your vaccine series. You have to be 2 weeks beyond that last vaccine dose, and you have to be within 90 days of the last dose. So it's a bubble that basically lasts 2.5 months, and it begins 2 weeks after you have completed your vaccine series. So during this 2.5 month period, if you have no symptoms and you've been completely vaccinated, if you are exposed to an active case of COVID-19, you will not be asked or you will not be required to quarantine. Again, that's not the main reason to get the vaccine, but it's icing on the cake. Just another good thing about the vaccination. So please remember, if you're sick with symptoms of COVID-19, stay home, consult your healthcare provider so that you can get expert advice and get a test. Practice social distancing, wear your mask, keep your hands clean. Thank you very much.
Thank you, Dr. Ruiz. At this time, we will hear from our representative from Phoebe Putney Memorial Hospital, Chief Medical Officer, Dr. Kathy Hudson.
Good morning. So, as it has already been said, our numbers are trending downward. As of this morning, we have 85 patients with COVID-19 in the Phoebe Health System, 72 of which are here in Albany. That is a significant improvement from weeks past. That's a 32% drop over the past 2 weeks of hospitalized patients. So we're hoping that this is the last significant spike that we've seen. However, we can't count on that. COVID is still in our neighborhoods, it's in our community, it's still being transmitted. So we still encourage everyone to wear their mask, keep their distance, wash their hands. To talk about the vaccine situation, it's been mentioned before. As of yesterday, Phoebe had administered 25,555 vaccines. That includes both first dose and second dose. Now, the number of vaccines is uncertain. but we did receive a supply this week, and we have enough through next week. So at this time, we discontinued making appointments for the first dose of vaccines to make sure we have enough to cover the second dose for everyone scheduled. We've expanded our vaccine sites, including 4 primary care locations. That includes Phoebe Northwest, Laurel Place in Lee County, Sylvester and Camilla. There are plans to extend out to Buena Vista Clinic next week. And we're also starting some pop-up vaccination sites in community centers in areas where there has been identified a significant number of eligible persons who may have difficulty getting to a vaccination site. So in order to ensure that those are really hitting the targeted areas, they're only going to be advertised in those neighborhoods. Because it's important that everyone receive a vaccine if they're eligible at this time. Now, based on our data at Phoebe, those of our employees that have received both vaccines, both doses, it's 99.9% effective in preventing their COVID infection if they're exposed. So we still encourage everyone, if you're eligible, please get vaccinated. Although we're not scheduling the first appointment, if you are eligible, you can still call 229-312-1919. That's the COVID-19 hotline, and get scheduled or get in the queue so that when we can expand out to the first dose again, you'll already be there. If you have concerns about your other health issues, talk to your doctor about the vaccine. You can also go to phoebehealth.com. There's some frequently asked questions that we have answers to. But it is vital that we all do our part. And if you're eligible for a vaccination, please do so. As Dr. Ruiz says, there's multiple reasons of the benefit. It reduces your risk of transmission of COVID-19, and it also helps prevent the need for quarantine if you're between 2 weeks and 90 days. So I encourage you, please, wear your mask, wash your hands, watch your distance, and get vaccinated. Thank you.
Thank you, Dr. Hudson. At this time, we'll hear updates from our Dougherty County Coroner, Michael Fowler.
I can see the light now. I can see the light. Seems like things are changing now. The death rate has definitely slowed down. The last couple of weeks, we did 11 one week and 11 the following week. This week, we only had 2 death residents in Dougherty County. I can see the light. I want to thank, and I know the different ones have already said, I want to thank the public for wearing your mask, doing what you needed to do. We got to keep doing it. I can see the light, what I'm saying. 3 months from now, maybe we might be able to start going to weddings, going to sports events. Maybe we can have a graduation of some form. If everyone keep doing what they need to do now, keep wearing your mask, the rate keep going down, I can just see the light, the things start opening up. I know I'm tired of wearing a mask. So everyone ought to be tired of wearing a mask. Now we wearing double masks. But if everybody do what they need to do the next 3 months, I can see June, July, man, things start opening up. Maybe I can go to do something different now. Maybe I can go on vacation. But if everybody don't do it, we still have a problem. And I agree, everyone need to take the vaccine. If everyone get the vaccine in Dougherty County, get the shot and get it out the way, there's going to be a more protection for all of us. If you feel uncomfortable about the vaccine, speak with your doctor. Speak with the medical profession. Decide that you need to have the vaccine. Because some people say, my medical issues, I can't take the vaccine. Well, talk to the doctor, make sure. Because we would love for everyone in Dougherty County to take the vaccine and have a protection in this bubble that we're trying to formulate. Like I said, I can see the light. I see things changing. Like I said, just 2 deaths. I wanted to get to the point that I only have to come up here because we had no death that week. So that's what I'm pushing for. I want to save lives. I want to help save lives. That's what the team here doing, trying to encourage the family, the friends, and the community. Let's mask up. Let's all band together. I want to say, many times I go to different events, I love to see someone get out the car without that mask. Before they get in the building, they run back. I got to get my mask. I got to get my mask. We got to all practice that. We got to keep wearing our masks. I'm not saying wear your mask while you're driving around in the car you're alone. You may not need the mask on then. But as soon as you get out the car and go into a building, a public building, or being around someone, put your mask on. So find a mask that fits for you. Somebody said, I can't wear the N95, I can't wear a double mask. Find a mask that is comfortable for you, that we can all practice the same thing and do the same thing. Because I know if I was graduating from high school or from college, I want to have a reception. I want to have a family reunion. I want to have a good time. I don't want to be masked up. But if all of us do it for the next, I can just see the light, the next 3 months, maybe we can kind of lighten up on some of the things. So again, I want to say thank you for doing what you're doing, and let's work together.
Thank you very much, Coroner Fowler. We are pleased to offer a presentation from one of our medical practices in the community, Albany Area Primary Health Care, who is here to provide information on the COVID-19 vaccine. Let's welcome the representative from Albany Area Primary Health Care, Rhonda Arline, Director of Nursing for Albany Area Primary Health Care.
Thank you all for having us here. Albany Area Primary Health Care is one of Georgia's largest community health centers and one of the region's largest medical groups. Vaccinating our community members is a major priority for our medical group. To date, our organization has vaccinated over 3,800 members of our community. In January, thanks to our partners at Phoebe, we were able to open a mass vaccination clinic at East Albany on Sylvester Road, a space that is much larger than our clinics. It allows us to vaccinate up to 500 members of our community daily. We are currently scheduling appointments at our vaccination center, and oftentimes a same-day appointment is available. Patients and community members eligible for the expanded Phase 1A vaccine rollout can call 229-338-7589 to be scheduled for an appointment. This information plus much more is available at our website at www.aaphc.org. On Saturday, February 20th, we will be hosting a mass vaccination clinic at Monroe High School from 8 a.m. to 5 p.m. This event is open to our patients and community members of Southwest Georgia. Appointments are required, so please call 338-7589 to schedule or visit our website at www.aaphc.org/coronavirus to request an appointment online. We are dedicated to providing quick and easy access to the COVID-19 vaccines for our community members. The mass vaccination clinic is just another way that our community members can receive the vaccine. I would like to share our contact information once more for any patient or community member who is eligible to receive the vaccine under the expanded 1A tier. You can schedule an appointment by calling our COVID-19 vaccine hotline at 229-338-7589. We have schedulers standing by to schedule your appointment. And you can also visit our site at www.aaphc.org/coronavirus for additional details. Thank you.
Thank you, Ms. Arline. Now we will open the floor up for questions at this time. This concludes today's press briefing. Our next press briefing will go back to our bi-weekly conference after today, which will place our next press conference at Friday, February 27th at 10 a.m. We invite you to tune in. Remember, mask up Albany, mask up Doherty, and stay safe. Thank you.